discussion this morning is all about those people that are terminally ill, where they have no hope of cure, and with various diseases we know that are incurable. And so the Nairobi Hospice comes into play, and we're joined in studio by Dr. Bridget Serengo. She's a nurse at the hospice, and she will help us understand more about what it is that happens in that particular organization. Thank you very much for joining us.
Thank you.
And good morning to you.
Good morning.
So take us through the Nairobi Hospice. When we hear about palliative care and the hospice and talking about people who are terminally ill, that there's really no hope for a cure, that this is pretty much somebody waiting to die, unfortunately.
Not really, not really. Nairobi Hospice is about living. It's not about dying.
Okay.
We know that most of the chronically ill conditions, for instance, cancer, for the majority of them, are not curable. So, and some patients, they might give up. But what we tell them, that even if your cancer cannot be cured, because they have tried to treat it by using drugs, by surgery, or by other means, and the cancer is advancing, it does not mean that you are dropping dead now. And that is why I am saying the emphasis is on living and not death. So what we do at the hospice is to encourage patients and their families not to give up, not to lose hope. We can help them to improve the quality of their lives. So our focus is, if cancer is not going to go away, or let's say, if HIV/AIDS has reached a stage where the antiretrovirals are not working and the patient is in full-blown AIDS, we don't give up. We focus on asking ourselves and the family, what is it that we can do to improve the quality of your life?
All right, so your focus is on life and ensuring the quality in that particular person with this life-threatening condition, terminal illness, is still improved, and there is value out of that and that kind of emotional support. So take us through the organization and what kind of, the diseases, that the kind of people you have, the age group. If we were to go there now, what situation would we find?
Nairobi Hospice, for a start, for those who might not know where it is situated on the grounds of Kenyatta National Hospital, just adjacent to its emergency and outpatient department. We do not have an inpatient facility there. It is an outpatient whereby those patients who are able to move can come to us, and then we will look at them, see what their needs are, and determine how best to address them in conjunction with the family. But those ones who are too ill to come to us, we will visit them in their own homes within Nairobi. And in fact, that is the greatest part of our work. We go into the patients' homes and help to take care of them there, and we teach the family what to do. So you have cancer patients, you have HIV. Yes, and we also take care of those others, like they might have heart problem, so they are very sick, so we support them in conjunction with their regular managing doctors. So the other, among the cancer patients that we see, the commonest are those who have got cancer of the breast, cancer of the cervix, the prostate gland, and those affecting the skin. You asked about the ages. We take care of a whole range of ages, because cancer does not respect any age. We have children, we have adults and old people.
And what is the state of their mind? Because this is somebody, in terms of a cure, then, you know, there's no hope for that. It's not going to happen. Whilst you say your focus is on life, that, you know, you don't want to be the people rubbing in that, you know, you're going to die, but the idea is that there's still life today and this moment. But what is the state of their mind, especially for those who are beginning this kind of a process?
Well, some of them, when they come, they could be low, they could be depressed, because they know that they have an incurable disease. That is natural. Yeah. So they could be low, they are depressed, but then through the counseling process.
So there's counseling?
There is counseling, and there is what we call the physical care, taking care of the general well-being, showing them how to bathe if they cannot go to the bathroom, having to teach the family how to feed a very sick person. There is the spiritual aspect. There is the social aspect, whereby you don't have to be, you know, so much confined, locked up into the house because you are very sick. So there is the social aspect. Also, for some of our patients, there is the financial aspect of it, because they are quite poor, and sometimes they have got children who have got to go to school. So through the support of our social worker, we have to network with the community and see what services are there from the community which can help, let's say, this family to ensure that the children still go to school.
Okay. And have you witnessed cases in which, because this is a tough situation, first for the person who's ill, you know, having to grapple with that terminal illness, and then also for the loved ones. Do you have situations where some are abandoned, that, you know, people decide, you know, this is just one of those situations, it's hopeless, even if we put in our energy, really nothing is gonna, you know, bear fruit from that kind of a situation? So do you have people who are terminally ill and all by themselves, and you're intervening and perhaps paying them visits with your social workers, and they're all alone and nobody else?
It is in the minority.
Okay.
Unfortunately, our community is quite supportive. However, there we have come across a few people. For example, they might have lived here for a long time, and their communities are in the rural area.
Right.
So they may be sick, but then they are not in touch with their families in the rural area. But for the majority, their families are quite caring, I must admit. Okay. And especially if they know that they will be supported to understand what is happening, and that the hospice will not abandon them.
So you talk about your rates being subsidized, but still about 90% of those in need of your services are unable to afford them. So how is it then you're reaching the larger populace that really is in need of your services? What are you doing to ensure that you can reach out to more people?
We normally appeal to the Kenyan community, either as individuals or corporates, to give us support. For instance, we have got events like annual golf, annual walk, musical concerts, that we mobilize the community to come and support us. And then on the individual level, we have also got this program we call Friends of Hospice. And through that subscription, individuals can make donations, and through this we are able to support those who cannot afford the drugs. Okay. It is our policy that whoever comes through the door of the hospice cannot be turned away. It is our responsibility. We have to look for ways and means of supporting them right up to the end. And sometimes, depending on the family's situation, through bereavement as well.
All right, it's Nairobi Hospice. Is your presence only here in Nairobi, or are you elsewhere in the country?
Our catchment areas is within 20 kilometers, although it is not neat and round. However, we have got a very strong training program where we have trained other professionals in other parts of the country, so that wherever a patient is, needing palliative care will be supported. So there are other units dotted around the country who share in the same philosophy.
But not facilities quite. You don't have, elaborate facilities in other counties, for example, to be able to offer the same services, do you?
They may not be elaborate, but they are.
Okay.
Yeah, they are in other parts of the country. And in fact, the government has taken palliative care very seriously. First of all, they were introduced at the provincial level. Now we are calling them different names.
Yes.
Let me use the old terminology.
Yeah.
They were at the provincial level, but now we are going at district or county level. So the government appreciates that there are patients in the community who cannot be cured, and there must be something in place to take care of them. So through the advocate, the services, they have come to appreciate what we do, and so they have also embraced palliative care, and they are trying to integrate it in the healthcare delivery system.
Right. And somebody watching this and hearing you talking about that presence at the provincial,
and district
level, and as far as the challenges are concerned in dealing and helping this group of people, what is it you would say you faced so far, and what are those shortcomings, the loopholes that you'd need perhaps addressed, either by, you said you seek that donor support, you're saying you're working with the government and they've been very helpful, although there's still very many people who are not getting this help, don't even know about it. So in terms even of getting the word out that there's this kind of services offered for the terminally ill, that's not information that has reached everybody, especially those in most need of it.
Yes, it is true. Awareness is important, and that is why we appreciate like now being here this morning.
Right.
Hopefully somebody out there is hearing me, so that if they have got somebody who is sick and they can get in touch with us, we will put them in touch with their nearest palliative care delivery service center if they cannot reach us at Nairobi Hospice.
Okay. All right. And the challenges you say you face are what?
The challenges are poverty, because quite a majority of our people are poor, and also cancer, HIV, AIDS, they are very expensive diseases. So you find that the family's resources are quite drained. So really, the challenges that we face, I would say poverty. Because I may go into a patient's home with the right kind of medication to relieve the pain, but then the person has not eaten, maybe for that day. Right. So what do? We have to at least donate something or help. But you will appreciate that buying and providing food is not sustainable.
All right.
Yeah.
Finally, for those who want to volunteer, I mean, we see many people when it comes to, say, children's home, the people who want to volunteer there. So this is a center that's really taking care. You said it's just it's not inpatient, it's outpatient.
Yes.
But of course, you're going to different homes. Do you allow for volunteers, and how can somebody get involved?
Yes, we do. We do welcome volunteers to do various things. However, if they are interested in supporting us to take care of patients, we expect them to come on our volunteer training program, so that we introduce them to the needs, to the special needs of this group of patients, and how best to support them. But then there are those who can help us in various ways, for example, in fundraising or doing like reception work. We have got daycare where patients come and spend the day with us. You find that volunteers like coming to interact with the patients, to help us cook for them, and such like activities.
Okay.
So those who are interested, they are very welcome.
They're welcome.
There is a lot we can do to support these patients and their families.
And your closing words to those who are watching, and we see quite a number of families, because when somebody is terminally ill and there is no hope for cure, there are those who choose to just lock them up in a room and, you know, just will have somebody serve them food, you know, once in a while. But as you said at the beginning, for you, your focus is on life, because there is still this person that is living at that particular moment. Though there is no cure and they're suffering from this particular illness, condition, or disease, what do you tell the people who do not care much, who will not perhaps seek services from you and others in their region that would provide to keep and give a valuable life to this person, even
not to give up, not to give up, and not to feel alone. You see, human beings, we have come to realize they are very caring people.
Yes.
And especially if they know that there is support. Mm-hmm. And they might be appearing to abandon their loved one because they do not know what to do. Right. There is this sense of hopelessness, helplessness, but there is help. There is help. So together with the family, we can walk the journey and see how to support the patient and the family. So they need not suffer in silence. Let them come forward and see how they can be helped.
All right. Thank you very much. We appreciate your time. Bridget Serengo from the Nairobi Hospice, thank you for joining us this morning. We wish you the best and all with all the work that you're doing over the hospice.
Thank you very much.